or it is a pleasure to introduce our fearless leader and president of Pregmedic. It's Dave Knoppert, who's from the University of Western Ontario, assistant professor in Department of Pediatrics, and would like to give him the floor so that he can give you a little bit of a wrap-up. But thank you to all of you.
Thanks, Don. You are really a bunch of keeners. It's 5 o'clock on a Friday afternoon, and it's June. Thank you for sticking around. Thank you for coming this afternoon, and especially thank you very much to all the speakers for sharing their wealth of knowledge and their experience. This ends the symposium, but just to summarize what we heard about today, first speaker was Dr. Davis from the U.S., and was telling us about that MScPhm program, and it will be interesting to see the effects of that and what the FDA does with that information. Then we heard from Dr. Mahar from Health Canada, and she talked to us about the Project Lifestyle. And if there's one thing, that circle that she showed us and her envisage of the future, maybe where that circle is complete, the outside circle, that would be nice. And I think it's important to keep track of Bill C-51 and see what happens with that. Dr. Korn presented the things which are happening in the States and the FDA narrative for the text, for the labeling, and that will be very interesting for all of us to follow. Then Dr. Scott from Health Canada talked about the H1N1 and made us aware of what was happening, and from his perspective, very interesting. I never heard the term reproductive psychiatrist before, but I think that's fascinating. Dr. Fischel, and thank you for that presentation. We often focus so much on the drugs, but it's the actual disease itself. And then JJ, thank you for that summary for herbal medicines. So I hope that this was useful to you. I hope that if you're not aware of Pregmedic before, that now that you've been introduced to it and you're aware of it and what we're trying to do, that would be important. So I'll just summarize there. I'm not going to take 15 minutes, take 2 minutes. And again, I thank you for coming, and I hope that you have a nice weekend and a safe trip home. Thank you.